Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristin Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Hello, welcome to Seven Figure Chiro podcast. I'm your host, Dr. Jeff Berard. I'm here along with Kristin.
Hello.
And today we're going to talk about something real important that chiropractors who want to scale, how to build the Rockstar associate. I think any one of us that had an associate, we interview these great young people that are eager and hungry to learn. And it's amazing when they come into the office because they're like sponges. However, what kind of systems do we use to assure that they can have the knowledge of your office and the autonomy to go into a room and deliver what you expect them to deliver, upholding, the policies, the reputation that you've built, your communication expectations, treatment expectations, recommendations. How do we encapsulate that so that associate can deliver what you expect? I don't know about you all, but it's when you hire an associate, you want that associate to become busy, and it becomes pretty frustrating when you hire an associate and everyone still wants to see you, right? That defeats the purpose and it doesn't allow you to scale. So I developed something not too long ago, recently here. It's the birth of the CERT, I call it. I've just created in my own office because we've had a little challenge with this. I call it the CERT Method. It's an acronym: communication, education, recommendation, and technique. We bring in associates. I review with them what our treatment models are. And we've had prior episodes on how important it is to have some staple treatment models in your clinic, in your office, so that there's focus and clarity. So we go over with these associates treatment models, and we have a handful of treatment models that address most issues that most people have that are effective for most people. When you bring on an associate, whether they have a couple years experience or whether they're right out of school, they don't have experience with your system and your expectations other than what you tell them. And we've had that problem. We have some great associates. Skill-wise, they're talented, but if they don't understand your form, your business expectations and standard for communication, education, recommendation, and technique, then when they go in a room, you have no clue what's being said, what's being done, and this can affect your bottom line. And we see that in our office, and this isn't fault of the associate. I think it's a fault of not having clarity and expectations for the associate. So this was the birth of the CERT method. So if a chiropractor nails these four areas consistently, they're not just an associate, they're going to be a rock star. So let's dive deep into each component. Number one, communication. Clear, confident, and congruent patient interaction. This is the biggest one, I think. Communication, you have to go in there, exude confidence, exude clarity, proficiency, being able to listen, really listen to what the objective of the patient is. It's really amazing if you were to hear what other associates say in the room when you're not in there. I'm not going to say it's bad, but it's to stay clear and focus on the objective of a visit. It's really easy to go astray on that. I invite all of you to go listen to communication of one of your associates. Just so you can learn. How do they evaluate tone and body language and the ability to build rapport? Super important. This is probably our biggest, or has been our biggest weakness with some associates that come into our office who are no longer there, but they just don't have an ability to build rapport. Skill-wise, great, but if you can't build rapport, it's going to be a very steep uphill battle. You're able to provide examples of what great versus poor communication looks like when you're in the room. If you hear something that you didn't like that your associate was communicating, you're not there to reprimand. This is a mentor moment. It's a learning moment to teach them what's the right way. And most associates want this and they need this because this is the hardest thing to learn.
I will say that with communication is because you are bringing on somebody else. Number one, you have to understand that they are not you and they are a totally different individual. So you have to embrace who they are, but also explain to them maybe why people come to see you. And so if they understand some of those core things that made you who you are and established your practice and you as a provider, it will help them.
So we talked about communication, which is, the obvious. How is your associate communicating with the client? Are they building rapport? Do they represent themselves in the business well? What's that look like? How can you help that associate become a better communicator? Education. Can the associate clearly educate the patient on their condition and how it relates to the nervous system and why the treatment that you're offering matters? Big deal. Again, a very hot topic with associates, which can be weak if you don't train them appropriately. Why the treatment recommendation that they're giving matters. If they can't articulate that and educate the patient on that, you got nothing. So is the message that educating the patient or client on, is it in line with your business philosophy, right? That's a big one. It's like I said, you'd be surprised when you go in a treatment room with an associate. When it's not, you can see it brings a lot of clarity to some weakness in those particular team members. Are they using the right metaphors or visuals and repeating what it is to make sure that the patient understands with clarity what their issue is? The more informed the patient is, the more educated the patient is, the more informed decision they make, and it's best for those delivering the care and those receiving the care. Recommendations. Again, this can go rogue in a hurry. I feel it does in our office at times, because in the past we haven't done a great job. We recently implemented this CERT method, how they deliver care plans and the next steps. If you have treatment models that we talked about in the past that are imperative to have to scale your business, and your associates going in the room and not following your treatment models and just kind of going rogue on their own, you have no control of growth or what that looks like because there's no standard. Are they confident in recommending care frequency, wellness care, or even referrals? Most associates that I've encountered in my experience of hiring associates over the last 2 decades is young doctors try to be heroes to their patient, meaning they try to solve the patient's problem in 1 to 2 visits, and they do everything they can because they want that validation. And we all know that just doesn't happen. Is there quick gratification from getting treated? Of course there is, but it's to take associates away from chasing pain, instead chase dysfunction, because that's what gets rid of pain. Dysfunction takes time, and I just don't think a lot of associates really have that mindset, because they have this thing where they want to be a rock star to the patient. They want to win them over so fast, and it can erode your practice if that's not nipped in the butt. And I'm not saying we don't want to get the patient better quickly. What I'm saying is the patient isn't better quickly just because they're out of pain. That's a big topic to pay attention to. Is their recommendations aligned with the findings of your clinic's philosophy and model? Again, this is piggybacking on that. That's kind of what we're working on right now. When we bring new team members in and they come from a completely different environment, a completely different treatment methodology, that's what they know. Especially if that was their first stop in their career, that's what they know. So you have to take time to foster and to cultivate this associate into your model, and it takes time. So pay attention to the recommendations, not just what they write on the SOAP note, but what they're telling the patient, because at the end of the day, that's what matters.
So when you're interviewing people, especially as associates, it's really important for you to be very transparent during your interview process so that they understand what your clinic and treatment style is and why people come to you. Because in Jeff and I, we go around and around when we're hiring associates. So there's hiring a brand new associate, one who is really moldable. And if you explained your treatment philosophy and it's something that interests them in any way, they are going to jump on board so quick, right? But you have to be able to spend a lot of time with them to teach them those things. Because if you hire somebody who's been in practice for 4 to 10 plus years, they already have their way of doing things. And so if it's completely separate and it has nothing to do with your treatment style and how you do things, you're not going to mold them very easy. So you have to like the way that they treat already. And then you can work on different ways of working together and kind of synchronizing both of your treatment styles.
So after recommendation, obviously technique is the last aspect of the CERT method. And, this is where the rubber meets the road, right? Do they provide treatment that's congruent to the standard that your clinic has? For example, Is your treatment methodology super gentle, easy, non-aggressive, non-high velocity, low amplitude thrust, or whatever it is? If these patients are coming in for that reason and you have someone that comes off the top rope, well, it's probably good to see that so you can at least share with them some other techniques that they can render to stay congruent to what's built your practice. Are they doing the codes that you expect them to do to adhere to your treatment models? It's a big one, right? Their code utilization. Again, this can be a problem. Is a lot of them, when they come to you, they don't have that system. They have no idea what they were being billed. They just went in and saw a patient, and maybe they just billed a manipulation and they weren't doing therapeutic exercise, or they weren't doing manual therapy, or they weren't doing all those things. You have to go in there to make sure you walk them through how to do what and when. And are they following, the technique protocols? In my office, it's very clear, our chiropractors need to provide some manual therapy, some therapeutic exercise, some form of manipulation. We do diversified manipulation. We do, flexion distraction. There's a lot of different things we do. When do you employ certain techniques and why? You can't just expect your associate to know that. So going in and doing that CERT is very valuable. So how do we execute the CERT system? Who evaluates? In your office, obviously, if it's a small office, the head doc can go in there, and when a associate is provided with a new client or new patient, have the doctor go in there and just, what I do is I say, when I go in with the patient, please don't mind me, I'm just going to do some scribing here. And I'm scribing our CERT document and writing down details on that visit so that I can review that with associate doc afterwards. If you're too busy and you don't have people, you need to see patients, and you have someone else in the office that knows your systems very, very well, they can go in there and provide that. Any team leader that knows the systems well can sit in that room and know the expectations that the business has of the associate doc. So find someone who can evaluate. We enter the room with the associate. We don't interfere. We're just there to observe. We don't stop the associate in the middle of their treatment. We don't try to do any of that stuff. We give them the respect. This is a learning moment. Let them do their thing. We use a CERT checklist and assess in real time how they're doing in each category. After the visit, there's a performance review. It's a one-on-one with the associate. I'll sit down with the associate and tell them what they did really, really well, and tell them what they did that needs some improvement to meet the standard that we expect. That's what that performance review looks like. If you don't have time to do it right after the visit, do it sometime soon after so that it's fresh in each of your minds so that we can move on and improve. The results of doing the CERT method, it improves patient retention big time and satisfaction. It's pretty frustrating when a patient comes in and they don't want to see that doctor anymore because it didn't follow your standard. The reason why they came to you is either they're referred, or maybe they saw the main doc before and he's not available, so they're going to the associate. You need to hold that standard. So it's a great tool to improve patient retention satisfaction. And the best part of this CERT is the associate becomes confident, and they become autonomous much quicker. And that's what you want. You don't want to have to, train someone for weeks and weeks and weeks. Your associate will become confident, and that's what you're looking for. That's what the business is looking for. That's what the patients are looking for. And the team culture shifts to a higher level of excellence, right? When you have people in the same boat, everyone's message is aligned, it's congruent, there's a current. That's what we're looking for. So this is a coaching method. It's not a correction method. We're not this isn't putting people on a chopping block. This is an opportunity to really get them dialed in to be rock stars. I do have a document that I use. Again, if anyone has interest in having access to that, reach out. Be happy to provide it. Haven't been using it for a long time because I just created it, but the amount of information I'm getting is so valuable. I wish I would have done this years ago, and I will continue to do it. That's all I have. I appreciate you listening. Until next time, keep up the good fight.
Goodbye.
Thanks for tuning in to this episode of Seven Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a seven-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.